Welcome to Frederick at its best. I'm Frederick County Executive Jan Gardner. October is Breast Cancer Awareness Month. Breast cancer and other cancers can affect everyone, regardless of age, race, or gender. Today, we gather to raise awareness about breast cancer and to focus on the importance of early detection. There's a 1 in 8 chance for women in the United States to be diagnosed with breast cancer during their lifetime, according to the American Cancer Society. It's the second leading cause of death in women after lung cancer. The numbers are worse still for members of certain racial and ethnic minority groups. Black women, for example, are more likely to be diagnosed with breast cancer while they are under the age of 40, and more likely to die from breast cancer at any age. Now, the good news is that there are more than 3.8 million breast cancer survivors in the United States today. The survival rate has improved thanks to dramatic leaps in cancer research, including some research that's being conducted right here in Frederick County. In fact, it was research at NIH's National Cancer Institute at Fort Detrick, who in 2008 discovered a new way to evaluate mutations in BRCA1, which is also BRCA1, one of the commonly known breast cancer genes. Women who carry a harmful variant of BRCA1 or BRCA2 have shown a greater susceptibility to breast cancer. The research being done at the Frederick National Labs may help save lives. Another reason we are seeing people survive breast cancer at a higher rate is no doubt because of the tireless efforts of passionate individuals and organizations, including healthcare providers, government agencies, nonprofit organizations, and advocacy groups. Right here in Frederick County, organizations like the Patty Horowitz Breast Cancer Fund raise money to provide local cancer patients with access to technology and services for early detection and treatment. The Frederick County Health Department's Breast and Cervical Cancer Program offers clinical breast exams, mammograms, and Pap tests at no cost to people with income limitations. In the past year alone, the Health Department has served over 570 women. And the American Cancer Society continues to educate the public about the need for routine testing. They've invested literally billions of dollars in research since 1946. We know that early diagnosis and better treatments make a difference. And we know that women whose mother, daughter, or sister were diagnosed with breast cancer are twice as likely to develop the disease. But many people don't realize that more than 85% of women diagnosed with breast cancer have no family history at all. That's why screening is so important. Getting regular screening tests is the most reliable way to find breast cancer early. The American Cancer Society estimates that in 2022, about 287,850 new cases of invasive breast cancer will be diagnosed in women, and about 43,250 women will die from breast cancer. All women over the age of 40 should get a mammogram annually. Early detection is key. Women whose breast cancer is detected at an early stage have a 93% chance of survival in the first 5 years. So early detection and mammograms matter, and it only takes a few minutes to get a mammogram. And I will say that the reminder of a year comes up faster than I think. Yes. So you need to make sure that you keep up with it, particularly following the pandemic when many people fell behind on their regular routine medical. You may also be surprised to learn that men can develop breast cancer. So everyone should see a doctor if they notice a suspicious lump in their breast while bathing or dressing, or notice some less well-known symptoms such as swelling of all or part of the breast, skin dimpling, breast or nipple pain, nipple retraction, nipple or breast skin that is red, dry, flaky, or thickening, nipple discharge other than breast milk, and swollen lymph nodes under the arm or near the collarbone. There's no sure way to prevent breast cancer. Some risk factors, such as family history, cannot be changed. There are lifestyle changes, however, that can lower your risk. Breast cancer prevention starts with healthy habits. There's strong evidence that suggests that physical activity reduces the risk of several cancers, including breast and colon cancer. So get out and walk. According to the Centers for Disease Control and Prevention, you can change your habits to reduce your risk. Breast Cancer Awareness Month is a perfect time to take charge of your health. To learn more about Frederick County Health Department's Breast and Cervical Cancer Program, call 301-600 300-600-3362. And again, that's 301-600-3362. Learn how to prevent and detect cancer and learn about the resources that are available in our community. So now I'd like to read our proclamation, and then I will invite everybody who's here with me to say a few words. Whereas breast cancer is the second leading cause of cancer deaths among women in both Frederick County and the state of Maryland, more than 5,000 women in the state will be diagnosed with breast cancer, and 840 women will die of breast cancer in 2022. And whereas the Frederick County Health Department has responded to the community need for breast cancer screening for low-income, uninsured Frederick County residents, and whereas in Frederick County we have demonstrated strong collaboration between the Frederick County Health Department Breast Cancer Screening Program, Frederick Health's medical providers, and community organizations, all dedicated to help breast cancer patients in our community and to reduce the incidence of breast cancer through early detections and education. So now, therefore, as the County Executive of Frederick County, Maryland, I hereby proclaim October 2022 as Breast Cancer Awareness Month and commend this observance to all of our citizens. So with that, we're going to introduce who's with us, and why don't we start with you, Beth?
This is on.
It is on.
It is on. Well, good morning, everyone. My name is Beth Mowry, and I'm the Program Administrator of our Health Department's Breast and Cervical Cancer Program. I want to start by thanking County Executive for having us here today to observe breast cancer awareness and the importance of screening. And I also want to thank the many community partners that are here with us today. In particular, I wanted to mention Vicki Weldon from Team Hope. In the past, our program has received on two separate occasions funding to allow us to screen more women through our program when our funding was depleted. But again, just glad to be here today. And for any woman who is in need of screening, who lacks insurance, please reach out to our program and we definitely can assist you further. Thank you.
Thank you. My name is Dr. Miriam Dobson. I'm the Director of Community Health Services at the Frederick County Health Department. I have the honor of working with Beth, and I want to echo her sentiment that it takes a community to ensure that all women of every ethnicity, race, background, strata of society have access, equal access to screening, because screening truly saves lives. So thank you, everyone that's here.
My name is Avnisha. I'm the health educator for cancer screening program at Frederick County Health Department. One of my role is to provide health education on the importance of cancer screenings. I also attend outreach activities in the community to educate people about our program. As County Executive mentioned earlier, our program offers clinical breast exam, Pap, and mammogram at no cost to underserved population. So if you would like to have more information, call 301-600-3362. Again, breast cancer screening can save lives, so please get it screened today. Thank you.
Hi, my name is Dr. Christine Harris. I'm one of the two breast surgeons at Frederick Health Hospital right here in Frederick, Maryland. And I'm very proud to be part of a team that provides expert world-class help to those of our Frederick community with breast cancer and beyond. We have everything that a woman would need for her breast cancer treatment, everywhere from surgery to medical oncology to radiation oncology. And our new precision medicine department is excellent. We recently, in 2022, won the Women's in Choice Award for one of the best breast centers in the United States. So we welcome anyone to come see us. Thank you.
Hi, my name is Roberta Taylor. I'm working with the Asian American Center of Frederick with my partner Nabila, and we are helping to recruit eligible women to the Frederick County Health Department for their BCCP program. So nice to be here.
Thank you. Why don't you pick up that microphone for Shada? Is it on? I think so, yes.
Okay. I'm Patty Horowitz from Colonial Jewelers, but more importantly today, the Horowitz Breast Cancer Fund. And first I want to thank County Executive Gardner for making the effort to make this proclamation today and increase awareness of breast cancer, because as you said, we really need to encourage women and men, if they see something that's suspicious, to get their routine mammograms. It's so, so important. I was diagnosed in 1999 of cancer, and it was very early, and it was caught on a routine mammogram. So from that experience, we started the Horowitz Breast Cancer Fund because we wanted to have the very best care right here in Frederick County. We didn't have a women's center at that point, so we had to go down the road for treatment. And I'm proud to say that in the last 23 years, we've raised over $2.5 million. Every penny of it has stayed right here in Frederick County. Every penny of it was pretty much raised here in Frederick County. And I just want to thank everyone in Frederick County for your generosity and for your care and your concern about women right here in our area. And we just really appreciate the support.
Good morning. My name is Vicki Weldon with Team Hope. I was diagnosed with breast cancer at 47. I'm now 65, and by the grace of God, I am still here. But if I were to tell you that my mother was diagnosed, my grandmother, etc., it wouldn't be unusual. But the reality is, the norm is to not have any family history. But I was diagnosed at 47, stage 2B, but out of that journey with breast cancer came Team Hope. And Team Hope, and actually from meeting Beth at the health department and learning about the health department and what they're able to do for women, there still are guidelines that they have to follow. So if they fall under age 40 or over 62, I believe it is, and are over the income level, then they don't qualify, they're not eligible for care. So Team Hope has been established to become that safety net under the health department. And fortunately, since 2011, we've partnered with some wonderful doctors who when we receive a call, we'll refer them to one of our partners. And then we've also partnered with Community Radiology and Frederick Health Imaging. So we're very fortunate, but over the last many years, we've helped over 1,400 women in Frederick County. And we literally cover the cost for any woman or man in Frederick County who is either underinsured or has no insurance at all. And all they have to do is make a phone call, and all of their expenses, all the way from clinical breast exam and follow-up care from our physician partners through any imaging to include breast biopsy. And all of that is covered through funding through Team Hope and through the generous donations of our partners throughout Frederick County.
Good morning. My name is Nicole Furr, and I'm a scientist at the Frederick National Laboratory for Cancer Research, where I've been there for over 20 years doing research on different types of cancer, including breast cancer, where we've done drug discovery to mechanism of action to actually drug development. And I've had the privilege of being able to work with some of the clinical trials down at NIH, where we've worked at the bench, we've put it to the bedside and come back to the bench and improved those different types of therapies. Personally, I lost a loved one this past summer to breast cancer. She had 2 different types of breast cancer that she fought for over 15 years. So I know all too well how important the research we do as scientists at the bench is to improving therapies and hopefully that eventual cure. And it's an honor and privilege to be here with you all this morning and to represent the FNL and kick off Breast Cancer Awareness Month. Hi, I'm Tracy Asbury. I'm one of the nurse navigators at the Frederick Health Breast Center. I help all of the new cancer patients that come in from time of diagnosis all the way through treatment, survivorship. We provide education, support, and try to help eliminate any barriers that the patient may encounter.
Good morning, everyone. My name is Nabila Putri. It's been a pleasure working with my colleague over there, recruiting women, eligible women into the BCCP program. And I just want to thank Jen Garner for having all of us today.
All right. Well, thanks to all of you for joining us today to help raise awareness about breast cancer and for all that you do to help women and men in our community get the preventive care and the diagnostic care that they need. For the great research, I have to say, I tell people sometimes that it's really going to be possible that in Frederick County we're going to find the cure for certain types of cancer, and I would love to see that happen. I think we can be very proud of the research that happens here, and we can be proud that people support all of your work with the Horowitz Foundation and with your organization to help people. It really is an amazing community. I always say we're a caring community and that we work together to really address some of the challenges we face. So thank you all for what you do. We really are going to make a difference today. But our message to all of you is to be vigilant about breast cancer detection. If you noticed a lump, please go and make an appointment with your doctor. If you need help, you can contact the health department. There is really a hope that we will find a cure for breast cancer. And today's ceremony is about making sure that people are more aware and do all they can do to prevent and detect breast cancer early so that survival rate continues to improve. So thank you for joining us for Frederick at its Best.